Hello everyone, today I would like to talk about the essential role of trauma radiology in modern patient care. In trauma situations, time is critical. When patients arrive after accidents, falls, or even gun violence, clinicians must make rapid decisions. Trauma radiology provides the imaging that makes those decisions possible. Radiology teams often move quickly from evaluating potential brain injuries to assessing abdominal bleeding or chest trauma, sometimes within minutes. Research continues to show how essential trauma imaging is. A recent critical review in the crisis and risk communication literature emphasized that radiological imaging is central to trauma diagnosis because CT, X-ray, and MRI give clinicians the information that they need to detect internal injuries and guide immediate treatment. The review also noted that improvements in CT speed and image resolution now allow subtle injuries to be detected earlier than in the past, which improves survival and reduces complications. The authors also highlighted the need to balance the benefits of imaging with concerns such as cost, resource use, and radiation exposure, stressing the importance of using imaging appropriately rather than automatically. Other studies have shown how strongly radiology interpretation influences real clinical decisions. One study found that CT scans interpreted in the emergency department changed the working diagnosis in more than half of the patients with abdominal pain and significantly influenced decisions for patients presenting with chest pain or headache. Another study found that when scans were reviewed by radiologists with specialized training in acute care, treatment plans changed in a meaningful percentage of cases. This demonstrates how specialized trauma imaging interpretation can directly improve patient management. Consider a patient involved in a high-speed car accident who arrives with severe shoulder pain and a visible deformity. The physical exam cannot fully reveal what has happened inside the joint. Trauma radiology provides the clarity needed. X-rays show the displaced humeral head. CT reveals multiple fractures of the scapula and a subtle involvement of the glenoid. CT angiography checks for possible vascular injury that could affect the viability of the arm. What initially appeared to be a simple shoulder fracture becomes a detailed map of injuries that determines whether the patient needs surgery, immobilization, or additional vascular or neurological evaluation. In some regions where trauma rates are high, radiologists are not always immediately available. One study from South Africa found that trauma surgeons often interpreted CT scans themselves when radiology reports were delayed. While most major injuries were identified, critical findings were missed in a small percentage of cases, including subtle vascular or cervical spine injuries. Even a small number of missed findings can have serious implications for patient safety in high-risk trauma populations. This is why trauma radiology is so vital. Trauma radiologists not only identified injuries quickly, but also communicate findings clearly in situations where every moment matters. Research has shown that emergency physicians prefer reports that are structured, concise, and actionable because they support rapid and accurate decision-making. In summary, trauma radiology plays a central role in modern trauma care. It provides the rapid imaging and precise interpretation that guide life-saving decisions, reduce diagnostic errors, and improve patient outcomes when time is limited and the stakes are high. Thank you.